You are joining the meeting.
So what if we,
That's Adobe.
so what if we put doorbells off right before the top of the hour? Whenever we switch out of the lobby layout for Maria to start the, welcome to the webinar, what if we turn doorbells off then so that we get the clean recording?
You bet. Okay.
Yeah,
Sounds
it might
good.
be a minute or two after the top of the hour, Jim, just because I'm not seeing people clamoring at our door.
Okay.
Now.
So yeah, just cue me. Whenever you switch layouts, when you're ready to switch layouts, I'll also take that as a, and that is somebody else who came into the waiting room. So now we have 2 people.
Okay.
All right. So
You ready to go?
Ready?
4 minutes too.
Yeah, I think so.
Yep.
Ooh,
Jim says yes.
Fun. All right, everybody who's not speaking, go on mute. And I will open the room.
Yes, hi.
Good
Who just joined the
afternoon.
call? Hi, who just joined? We've got somebody who was really good. They joined the call and they muted themselves immediately. Yes, hello. Hi, who just joined?
Justin Weiser, Washington State Department of Health.
Excellent. Welcome. Okay. So please go ahead. We're glad you're with us. This is Jim Vetter, and please go ahead, and if you look right down near the bottom of the middle section of the screen here, well, you'll see that there are 2 polls there to answer, and also there's a little space down there to share some information about yourself. So if you just type in the chat that your state or jurisdiction, your title, any of your main injury and violence prevention topics of focus in there. So who else has joined us in the call?
Hi, it's Jeff Hill in Rhode Island.
Hey, welcome, Jeff.
Thanks.
This is Jim and Maria welcoming you. So Jeff, if you would as well, just go in and at that little chat area, just type in those information. Hi, who just joined the call? Sounds like someone just joined. Who just joined us? So go ahead and then, if you just joined on the phone line, just unmute yourself and say hello. So we can hear your voices. And as you're joining, please go ahead and just respond to the polls that you'll see on the lower left of your screen and the questions in the lower right. Hi, who just joined the call?
Oh, yes, Christina Costa.
Welcome, Christina. And whereabouts are you from?
Oh, DOH, Division of Family Health.
Excellent. And hi, who just joined? Welcome, welcome. Who just joined the call?
Hi, this is Kelly from Indiana.
Hey, Kelly from Indiana. This is Jim from Boston and Maria from DC. Hi, who just joined?
Hi, this is Catherine in Washington State.
Hey, Catherine. This is Jim from Boston and Maria from DC. And Shai from
Good morning.
Boston. Good morning. So folks, please go ahead as you're joining and respond to the polls that are on the lower left, and then respond to the question in the chat near the lower right. Hi, who just joined the call?
Hi, this is Devetta Henderson with the Division of Mental Health and Addiction.
Welcome. We're glad to have you with us.
Thank you.
So please go ahead, everyone, as you join, go ahead and answer those polls and answer the questions over in the lower right. Okay, and Pennsylvania's got a whole crew there. Welcome. So, and Pennsylvania, have you had a chance to say hello on the phone yet? But if not, please go ahead and just unmute yourselves and say hello. We'd like to hear Tina and Angelo and Elizabeth and Josh. Okay, it's a jackpot. Hi, who just joined the call?
This is Tiffany Jameson from Ohio Department of Health.
Great, welcome. This is Jim Vetter from EDC in Boston.
Jeannie B.
Hey, Jeannie.
Hello.
Jim Vetter here. Okay, folks, as you're joining in, please just go ahead and respond to the 2 polls that are in the lower left, and also to that chat question that's over on the lower right.
Great. Thank you all so much for joining us today. This is Maria Cotratus from CSN. And thank you, Jim, for welcoming everyone as they started coming into the room. If you just joined us, you are not going to be muted, so you can self-mute if you are in a noisy environment. But we do hope that you will join us in our discussions and in our chats and polls throughout the call. We have a couple of polls up right now, so if you have a chance to, please answer the polls, the 2 polls on the left-hand side, and share some information about yourself on the right side. We see some familiar names and some new names, so we're very happy to have you all with us today. Thank you so much for joining us. So we can get started, and the chat will remain up, so you will have a chance to continue sharing some information with us. Thank you for joining us today. Our topic today is social and emotional learning and mental health, an integrated approach to promote child and adolescent well-being. And this is a really important topic for us at CSN. So we are funded by HRSA, and we are HRSA's primary vehicle for injury and violence prevention among children and adolescents in the United States. And we have some tech tips to start off, just so that we're all on the same page. If you can hear me, you have called in already. Please mute yourself when you're not talking. You can use your phone's mute button or press *#. You can use the chat box that will appear on the left-hand side at any time to ask a question or chime in on the discussion. We will have some resources that will appear at the top, and the session is being recorded and will be posted to our website on our calendar and under webinars. And we would love for you to interact with us today, so if you can, please go ahead to the top of your screen and click on the hand raise button to participate in our verbal polls or to be called on. And if you can test it out now, we would love to do that. I see Christina has already raised her hand. Thank you so much. We hope that you'll be able to use this throughout the call to participate and to let us know that you have something to share with us. So I would love to introduce everyone. My name again is Maria Cotratus. I'm a Child Safety Learning Collaborative co-manager at the Children's Safety Network. And our 2 presenters today will be Shai Fuchsman and Jim Vetter. And I'll let you know a little bit about each of our presenters. Shai is a behavioral health expert and senior research scientist who leads initiatives that promote the positive development of youth through his leadership of the Education Development Center's Socio-Emotional Learning and Mental Health Academy. Shai is providing intensive professional development to help Massachusetts communities create teams of change makers who are establishing multi-tiered systems of SEL and mental health support. And as a prevention solutions at EDC training and technical assistance specialist, he supports state agencies and community-based organizations nationwide. And Jim Vetter is one of our very own, so you may have heard from him before if you've joined us on any previous state technical assistance webinars. He is a Child Safety Learning Collaborative co-manager and the topic lead for bullying prevention. Jim has over 25 years of experience supporting diverse communities domestically and globally in promoting social and emotional health and well-being. He is Associate Director of Health and Technology at Education Development Center and is on the leadership team of the Socio-Emotional Learning Alliance for the United States. So we are very happy to have you both joining us today. And without further ado, we will begin.
thank you all for joining us.
Great, thank you, Maria. This is Shai Fuchsman. It's a pleasure to be here with you all. Thanks for joining us. So I'm going to start off by just telling you a little bit about what we hope to do over the next hour or so. So the purpose of this webinar is to introduce you all to the idea of a multi-tier system of support approach for providing children and youth to SEL, social emotional learning and mental health needs. Now, the concept of MTSS, as we will talk about in just a few minutes, is becoming a very popular concept in the field of education. And I saw from the poll that some of you are already familiar with it. MTSS is an approach that can be used not only for SEL and mental health, but really for any subject, including academic subjects. And it basically, what it does, it talks about the importance of providing strong instructional practices and school-wide policies that will help all students, as well as additional supports for students who need additional support. And again, this can be applied to learning math or can apply to building social emotional skills. Now, as you'll probably, you might have already noticed, and you'll notice even further once we really dig into it, is that this concept of MTSS is really not that different from what we in the public health field have been talking about all along. This idea of promotion of health, as well as prevention at the universal, selective, and indicated levels. They don't quite exactly match, and we can talk about some of the differences, but basically it's a very similar idea. And so by talking about MTSS with all of you as public health professionals, what we're hoping to do is provide with a common language that you all can use to collaborate with education people in your states, whether it's at the state level or at the community level. We not only to provide a common language, but obviously by having a common language to promote collaborations, ultimately to ensure that children and youth in your communities receive the SEL and mental health services they need. So that's the purpose of our webinar today. And specifically what we're going to be doing is we're going to be articulating the need for social emotional learning and mental health supports for children and youth. If you're not bought into the idea that this is important, we hopefully will convince you by the end of the webinar. And if you already are bought into it, and I hope that many of you are, we're hoping to provide you some strong talking points that you can use with stakeholders in your states. Second, as I mentioned, we're going to describe not only what is a multi-tier system of support, but also specifically how it can be applied in schools and school districts to provide students with the SEL and mental health needs, to address their SEL mental health needs. Third, and I think this is particularly important and how we want to really make this relevant to all of you, is talk about what are some specific opportunities for collaboration between community level and state level public health agencies, mental health agencies, and education agencies to build on this idea of a MTSS approach to SEL mental health. And I hope that this is especially what becomes helpful to you as you leave this webinar today. And lastly, to drive this, to kind of summarize everything and drive this all home, what we also want to do is to provide a specific case example of the work that we're doing here in Massachusetts. Maria alluded to it in my introduction. What we're doing is working closely with the Massachusetts Department of Elementary and Secondary Education, that's our state education agency, to help school districts across the Commonwealth of Massachusetts, and particularly those that are based in high-need communities, to support the needs of to support SEL mental health needs. And one of the things that we emphasize really is the collaboration, both in our work with DESE, with our state education agency, how they can collaborate with other agencies, other state agencies, but also at the local level, what does that collaboration look like as well. So hopefully that will provide some very concrete ways in which you can think about partnerships in your communities. And with that, I'm going to turn things over to Maria.
Thank you so much for that wonderful introduction and overview of what we'll do today. So we will have a brainstorm chat. So whenever you see this type of slide on our screen, it will encourage you to raise your hands and participate, and also type into the chat at the bottom if you're a little bit shy, but we do encourage you to speak up. So our question for you now is, why do you care about promoting social, emotional learning and mental health in your state or jurisdiction? And again, you can chat at the bottom or raise your hands and speak up. And I see Melissa Hines. A couple of people are also already chatting at the bottom. Melissa, would you like to share with us why do you care about promoting SEL and mental health?
Sure. Just by unmuting, I can't type and talk at the same time.
Okay. Yes, you can just unmute and chat with us. Yes, of course.
So I serve on the Maternal and Child Health Block Grant Program team, and we're in the process of writing the 21-25 application for HRSA, Title V. And besides just, being a human and being interested particularly in adolescent risk, and interested professionally in reducing adolescent risk and reducing self-harm behavior and suicidal behavior in adolescents. We are looking at incorporating SEL as a strategy and an action plan for our HRSA application in the adolescent health domain. So I'm particularly excited about this webinar because it comes at a time when I'm trying to look for language to build into this application to HRSA.
Wonderful. I'm so happy that you're joining us, and maybe you can get some ideas from today's webinar. And I'm really happy to hear that you're building this into your application to HRSA. Are there any other folks who are in?
We're considering that, and my colleague Maria Geiger is also online. But we're in the process of figuring that out. But thank you, Maria.
Wonderful. Is anyone else in a similar situation? Are you preparing your applications and plans for HRSA? And finding this to be a useful topic to include? Are you considering including it? Great. Christina, would you be able to share with us a little bit about what's happening in New York State?
Yeah, sure. So we as well have a section for the Title V grant, social emotional wellness, and trying to incorporate that in the various programs that we hold in the various departments, with the contractors, and we've done some work for ACEs, and so we're also working on our next 5 years.
Great, that's great to hear. And I see Jeff in Rhode Island is also talking about SEL with students. So I was wondering about how you're interacting with, I'm assuming, the Departments of Education within your state.
Sure, yeah. We do interact with our SEL group through our Department of Education. I have staff members that attend those meetings, and I think I have a meeting with the commissioner next week to talk about more supports through that, either through our core violence or through our Garrett Lee Smith grant. On our core violence, we do work, group education work on emotional regulation, work in several different school districts, working with school counselors to deliver a group therapy type program with students in the schools to work on those issues for kids who are at risk for intimate partner or sexual violence.
Great. I'm happy to hear you incorporating your school districts and different risk factors. And I see, I'm sorry, I skipped Mariah Geiger, who's from Wisconsin. Could you let us know a little bit more about what's happening in Wisconsin?
Hi, yes, thank you so much. I'm kind of a guest on the call line with efforts that are with colleagues that are more often attending these meetings, as far as I understand. So I'm the early adolescent health consultant, and like I said in the chat, we see it as a building block for so many positive outcomes and really an aligning factor. So we're aligning with the Department of Public Instruction, kind of the same way that Jeff described, as well as across hopefully some of the ways that we do injury prevention in Title V. And then my role is actually when not talking about content expertise for adolescents overall, I'm talking about our teen pregnancy prevention programs, and they are incorporating a lot of social and emotional learning and positive youth development. It's just much more upstream.
Wonderful. So I'm hearing a lot of examples from incorporating injury violence prevention and a lot of other topics that are really surrounding adolescent and youth health and well-being. So I'm really happy to hear all of these examples. You can continue chatting in the chat pod, but we will move on because I want to make sure that we maximize Jim and Shai's time on our call. And thank you all for participating, and we'll continue our conversation. Thank you.
Okay, so a lot of strong reasons why folks in states around the country care about social-emotional learning and mental health and promoting these for young people. And it sounds like lots of you are already building strong connections and relationships across agencies. And you're thinking about in the different kinds of grant programs that you have or title programs, how to really have a kind of strong core of social-emotional learning and mental health to be able to address the whole range of child and adolescent health issues that can be addressed by that. So we saw in the initial poll that folks had a kind of range of experience around social-emotional learning, that we know we've got some folks on the call who have quite a bit of expertise around it, and also some folks, as we expected, were saying that this was sort of a newer concept for them. So we just wanted to touch up quickly on, when we talk about SEL, what are we talking about? That the definition that comes out of the Collaborative for Academic Social-Emotional Learning, CASEL, says that SEL is the process through which children and adults, not just for kids, it's us too, acquire and effectively apply the knowledge, attitudes, and skills necessary to understand and manage emotions. I think Jeff was talking about that emotional management, to set and achieve positive goals, to feel and show empathy for others, to establish and maintain positive relationships, and to make responsible decisions. And we can see how these things really play together, that as we're thinking about how do we help children and adolescents develop the kind of self-awareness to recognize their own feelings, their own strengths, their own needs, to have strong self-management, to be able to manage strong emotions, for example, to be able to have social awareness, to understand the perspectives of other people, to build strong relationship skills. And in a way, all of this builds towards having strong, responsible decision-making. And we can see that in so many of the risk areas, being able to make those decisions, manage emotions, and make decisions is really critical, certainly for adolescents, true throughout the life, but there's so many times in adolescence that this really comes up as a key topic. So SEL can really provide a strong foundation around all of this. And we see that the positive results, that having those kind of connections, we're thinking about young people in school settings, we know having strong connections influences the ability to learn. That we know that emotion and cognition are really just inextricably linked together. That if we're able to access our emotions, just understand our own emotions, that can help us think through lots of important situations. And this all kind of adds up to there are many risky behaviors that can be prevented or reduced if we have a strong base, a kind of universal base of social-emotional learning for all young people. And many people involved in youth development and education have known this for a long time. What's been different in the past couple of decades is now we have very strong research that demonstrates what lots of us already knew. So we see that in communities that have a kind of systematic approach to social-emotional learning, we see decreases in physical aggression, we see decreases in depression, in anxiety. We see that those decreases, those positive results, are really maintained over a long time. So we see violent and drug crime convictions going down. lower risky sexual behaviors. We see increases in things like college readiness, career success, having strong and positive relationships, better mental health, and more engaged citizenship. And when this is done in school settings, some people are worried about, if they're going to be thinking about things like defining and managing emotions and building relationships, is that going to take away from core academics? In fact, what the research shows us is just the opposite, that if we have a strong base of social-emotional learning, those communities, there was a meta-analysis that looked at over 200 studies, rigorous studies, of communities that were using a proactive, consistent approach around social-emotional learning. Those communities shows an 11 percentile gain in academic achievement, at least as measured by standardized test scores, which we know that's not the be-all and end-all, but 11 percentile points higher in academic achievement than communities that weren't using social-emotional learning. And that overall, for our communities, there was a cost-benefit analysis that showed, as you think about the kind of costs of all these risky behaviors, that $1 spent on social-emotional learning had an $11 return for every dollar spent. So building that core is really key. But is that really enough? Is that all we need to do? But we know it's also really important to have strong mental health supports for young people. That we know from the evidence that 1 in 5 children and youth have an emotional, behavioral, mental health disorder that could be diagnosed. And that at least one half, some estimates say as many as 80% of these children don't actually receive any mental health care. And that if we look at the end results, that over 50% of students who have emotional and behavioral disabilities, ages 14 and older, end up dropping out of high school. At the same time, we know from the evidence that if there's early detection and intervention, then that can help improve resilience, lead to positive outcomes, success in school, and more broadly in life. So really, as we think about it, we can see the kind of issues that often in many of our public health issues. I used to work for the Virginia Department of Health, where I led the youth violence and suicide prevention program for the state. So we saw the issues about interpersonal violence, self-directed violence. We saw the issues of substance use. Now we see the opioid crisis happening, that school failure. Those are kind of the tip of the iceberg. Below that, we can see the kind of factors that may contribute to these, the kind of behavioral mental health problems, and the other community conditions, the biological predisposition, kind of identities that may lead to these, what we see is the issues that arise. So as we think about looking at the socio-ecological model, we know that there may be some predisposition to some mental health disorders on the individual level. We see the difference of whether there is peer and family support. We see the difference of whether there's a safe or unsafe environment. And that may be safe or unsafe depending on whose identity. And we see that many LGBTQ youth are showing high signs of suicidality if they're in an environment in which they are not acknowledged and supported. And then we see the kind of the societal pressures that if we're in a family where there's simply not enough money to go around, then of course that creates pressure. That means that adults at home can't have the kind of the engagement and support that they would like to have. So as we look at that overall, we know that there are many different factors that can address, that can lead to these risk factors. So let's find a little bit more about how you're addressing this in your state. Maria.
Great. So this is another brainstorm chat. So if you would like to type in at the bottom or raise your hand and we'll call on you. We would like to know what are some examples of social emotional learning mental health initiatives in your state or jurisdiction. And please feel free to chat at the bottom or raise your hands. And I see some folks are already chatting, so I will call on you. Terry, could you let us know what's happening in Tennessee?
Hey, this is Brittany from Tennessee. I don't know if Terry can get
Okay,
on.
Brittany, you can let us know what's happening in Tennessee.
We have several things. One of the department's focus right now is mitigating and reducing ACEs. And then we also, Department of Education has the Project Aware grant, which focuses on mental health awareness. And Janet can speak more to that as well.
Hey guys, I'm sorry instead of hitting the unmute, I hung myself up. This is Terry Love. Can you hear me?
Terry. Yes, we can.
Apologize.
Thanks for joining us.
One of the kind of interesting things that I haven't shared with this group before is we're partnering with the Nashville Coaching Coalition to do some sports programming, safety programming, mainly around our Safe Stars concussion prevention. But that coalition, it works really hard to do the social emotional learning training for coaches. And if you're interested in that, if you're interested in connecting with Scott Heron, who's the CEO, and their work, I would encourage you to visit that website. I'll put it in the chat line for everybody to see. But they're doing some really interesting work with these concepts with coaches. And athletic coaches they have a tremendous amount of influence on youth and can identify and know about and identify issues with youth very early on. And so that may be an area that if you have not worked with in the past, we kind of approach them with the coaching boys and the men, and then it has bled into other areas because of the work they're doing. And their conference is this July. It's a great conference. If you're interested, if you need an excuse to come to Nashville and you're interested in this area, that would be a great conference to attend. You can contact me for more details. I'm sorry to interrupt you, Brittany. Sorry to interrupt you. I'm sorry, but go ahead.
Great. Thank you so much. And I would like to encourage anyone who's sharing out some information today to also include any links to any publicly available information about the programs in your states or jurisdictions, and we would be happy to see all of them. Thank you for sharing that, and I want to keep pointing out as we go along that we're hearing a lot of examples that include different types of folks. So the example that Terry just shared was with coaches. And so we are hearing more examples of all of the interactions that youth may have in our communities and finding ways to reach them in a variety of settings. So I did see some more folks chatted. Christy Hart, could you share some more information about your pyramid model implementation?
Sure. Can you hear me?
Yes, we can.
So yeah, New Hampshire is implementing pyramid model in early childhood and elementary school settings in various portions of the state. We're working on the scaling up currently, and then we're also in the process of exploring the potential for implementing pyramid model in home visiting as well.
Wonderful. Thank you for sharing an example from New Hampshire. Excuse me. And Sally, your neighbors, could you share with us a little bit about what's happening in Vermont?
Hi, can you hear me okay?
Yes, we can.
Yeah. Just over the last couple of months, we've been doing, because we have a CDC highly trained epidemiologist here in Vermont, which is a luxury for us. She's been doing a lot of deep dive into our YRBS data and LGBT and trusted adult, and finding out that the relationship between trust in a trusted adult or an askable adult and the LGBT, especially the trans, the T part of the LGBT, isn't as strong as we would think it is. And we're having conversations about maybe we have to go back to these adults in the school building that might be considered a trusted adult and see what they need in support of LGBT youth. And so, of course, I'm thinking of the sports coach model that was just described, and that would be something that we were thinking about yeah, I mean, there's a lot of adults in the building. They have a lot of skills. They're trained teachers or trained counselors, but how able are they to talk about LGBT? And I think especially the youth who may be considering gender identity issues, that might be something a little more new for these folks, and they need some extra guidance in how to be a trusted adult. So it's interesting to have that conversation and then be on this webinar and hear about what other states are doing.
Great, and that's a really great example of using your YRBS data to inform any potential interventions and trying to see what else is necessary in your state and how you can go about this. I see a few more folks are typing in. Erica, would you like to share what's happening in your state?
Sure. Christy already kind of shared for New Hampshire, but I just wanted to type in these couple links with some more information if people were interested.
Oh, wonderful. That's absolutely wonderful. Thank you for sharing.
You're welcome.
And I do encourage everyone to do this. If you have some examples from your states, that would be wonderful for all of us to share. I see Jeff Hill is also typing. Jeff, do you have anything to share from Rhode Island?
I put it on the discussion board earlier. The last 2 years, we've been working very closely with our largest state teachers union on planning mental health supports and training for teachers that can be delivered outside of the school day. So it's not a part of their daytime professional development that they would do within their school district, but this is more of an opportunity for them to do professional development outside of the school building on Saturdays, Sundays, or in their own time, depending on what it is, and kind of centralizing that training and working with them to essentially use their union dollars to pay for their training and not necessarily putting it all on the district.
Okay, so is this voluntary training, or are they required to participate in some sort of training?
The Department of Education changed their credentialing requirements for teachers, where they increased the amount of credits needed, but also the diversity of opportunities for teacher continuing education. And so as a part of that, we were able to open up the door to look at mental health training, which they all wanted anyway, as a way to do that.
Great. Wonderful. It's fantastic. Melissa, I see that you just typed in. Could you share a little bit about what's happening in your state?
Yes, just that we are looking at, we work closely with DPI, as Mariah, our state education department, mentioned earlier, that administer the state YRBS. We've had a very robust response from 19, and we are hoping to utilize a couple of identified variables to track over time as a measure to report in our HRSA Title V work, specifically the connection to a trusted adult, which does seem to be have a fairly broad or a deeper evidence base for association as a protective factor.
Wonderful. So I do encourage you to share some more information about how your states are all working on your YRBS data, because that is the majority of our data on adolescent well-being is coming through the YRBS. So we will move on to our next section, but if you have any other links or resources that you'd like to share with the other folks who are on our call, please go ahead and continue entering them in the chat. This will be a wonderful resource. Thank you so much.
Hi, sorry, I was on mute. So this is Shai again. What I'm going to be talking now about is, now that we've talked about SEL mental health and the importance of SEL mental health and how important it is to incorporate it into how we support our children's education and their growth, what does a multi-tier system of support really looks like? I did have a chance to quickly look at the link, the PDF document, by the way, that Erica just posted from New Hampshire, and so this next section is going to sound very familiar to you, Erica, because it does overlap a lot with what you're doing in New Hampshire. So the basic foundations of MTSS, this is kind of the image that we are used to seeing or kind of thinking about anytime we think about MTSS, are these three tiers. Tier 1, Tier 2, Tier 3. Tier 1 is how do we teach all of our children these core SEL skills, the ones that Jim talked about, emotional management and goal setting, perspective taking. Those are skills that all of our students need. And so how do we make sure that we have quality education programs in place that specifically build those skills? So that's for all students. In addition to that, we know that some students are going to need additional supports. For example, Tier 2, which are more the targeted small group instruction, and Tier 3, which are the more intensive and individualized interventions. So let me give you a few examples of each specifically to SEL and mental health. So on Tier 1, there are many standalone curriculum out there that are evidence-based. CASEL, which is one of the leading organizations around SEL, has a wonderful guide that provides information about what are evidence-based SEL programs. So does the Wallace Foundation. In fact, there are a couple of those. Actually, the What Works Clearinghouse, which is the U.S. Department of Education's repository of evidence-based programs, they now have an SEL section that provides information about what are SEL programs. The challenge with standalone programs is, if you ask any teacher, is where do we fit it in the school day? We have so many other demands on our time. Having an additional standalone program can sometimes be difficult to fit. Well, that might be the case. That's not necessarily a reason not to do SEL at the Tier 1 level. There are other ways of incorporating SEL to the things that we already are doing in education. That includes promoting SEL skills in opportunities to practice in the classroom, be it through having students work in teams, develop that relationship building, that perspective taking, or whether it means teachers just being more intentional about the way they develop meaningful relationships with students to promote that relationship building piece, or just by having conversations, through the literature, through the, ELA classes, social studies, about what does it mean to have these skills and how do we build on these skills. Also, SEL-wide SEL promoting practices. And again, the key thing I think here is being intentional. How do we organize events in the school that are promoting SEL practices? There's a great example from my own community here in Massachusetts that I'd love to share with you. So we had a new principal come into one of our schools, one of our elementary schools actually. And one of the things he did, as any new principal would do, is he had conversations with the teachers, with parents around what are the needs of the school. And he decided to engage his students in this kind of conversation as well. What is it that you need? And the first topic that students talked about was, we want to improve our recess. We think that recess, it's too restricted, or the teachers don't let us do exactly what we want. And so he decided to have a recess committee. And he engaged a few students and he had conversations with them, and they developed an action plan for how to improve recess. That, to anyone just kind of hearing this story, might feel like, well, what does this have to do with SEL? Except if you think about it, the way he did it, he intentionally thought about, how do I promote social awareness? How do I promote perspective taking, so that we're all thinking about each other's needs? How do I promote goal setting? And in fact, this was so popular that he went back to students and talked about what else can we do, and they wanted to have a cleaner community. So he did create another committee of an environmental community, and again, environmental committee. And again, what he did was he met with a group of students over lunch over several weeks and developed an action plan promoting these SEL skills. So that's kind of a nice way of doing this through a school-wide approach. There's other ways, obviously, in Tier 1, modeling social-emotional skills and mindsets. Can we model what does it mean to manage stress? In fact, a recent study published by some of our colleagues showed that when elementary school teachers show anxiety about math or talk about anxiety doing math in their classroom, their students are more likely to do worse in math compared to teachers who don't talk about their anxiety. So basically, the finding was that we as adults can project those our fears, our anxieties to our students. Now, it doesn't mean we shouldn't be talking about our anxieties, but if you're going to talk about your anxieties as a math teacher, you might want to be thinking not only about talking about your anxieties, but also how do you manage the anxiety? What can you do with that anxiety? And that's a great example of a way we can model emotional management with our students, particularly around math. So that's a kind of very concrete math example. And lastly, mental health literacy programs. In health, more and more schools are thinking about mental health as part of their health curriculum. We know that it is, when it comes to physical health, it is important to talk to our students about, exercising and nutrition. Well, that's true for mental health as well. We want to be promoting that. We want to be kind of adding that mental health promotion piece to our education. So that's Tier 1. Tier 2 is about finding students who are at risk. And again, this is kind of coming straight from the public health approach. We understand this more than any other field, that some students will have risks in their community, as Jim talked about, because of individual level risks. For example, having genetic predisposition to a mental health condition, or risks related to peer relationships or family situations where there might be, for example, trauma, community level risk factors such as discrimination, for example. Someone talked about risk factors for transgender youth. We actually, and I think we're about to add a link, we just published a paper showing that transgender youth are higher risk for substance use using a similar data source as data set as the WireBS. And the argument that we make in that paper is that it's not about the experience of grappling with your gender identity that is the risk factor. It's the not having the support to grapple with that within your context, whether it's within your school, within your family. If you're not able to talk to people about it, if you're not able to have people who understand what you're going through, or at least be able to try to understand what you're going through and helping you, that is the extent that those stress levels can go up and lead to risky behaviors, be it substance use, suicide, etc. And so understanding those kinds of risk factors is what get us to, and identifying students who are experiencing those risk factors is what gets us to the Tier 2 and Tier 3 supports. And that includes things like helping students build some of the SEL skills in the classroom, so having kind of additional support for students in small groups. It could be mentoring, so making sure that students who are struggling have a one-to-one relationship with a caring, responsible adult. If it's not happening outside the school, then definitely within the school. I believe the WireBS or some of those similar kind of surveys actually ask that question of students: do you have a caring adult to support you? Understanding, making sure that that's happening, again, in an intentional way. Family engagement when appropriate and when feasible. How do you make sure that parents or other family members are enforcing those skills for kids who are struggling? And small group social skills. So, for example, my child's school has a lunch bunch program. You probably have heard about it too, where students with social pragmatic challenges might get together over lunch with a professional facilitator, or group-based mental health support. So, for example, for children experiencing trauma, they might have a group-based mental health support. For example, an art therapy group. And then, of course, there's the Tier 3 supports for students who really need individualized mental health supports. And that could be both referral to outside mental health counseling, and that's when the mental health services or agencies are critical, but also in some cases in-school counseling. And obviously, there's different kinds of mental health therapies that need to be matched to the right need. Now, those are the building blocks of MTSS, but MTSS is a system. It's not about the 3 tiers, but it's really about bringing all that together in a coordinated way, in a fluid way, in a way that is both data-driven, culturally competent, and sustainable. So just going quickly through some of those elements. So again, data-driven. Do we have the data systems? So we've already started talking about that. Do we have the data systems in place to understand what are the needs of the general population? So there are great SEL assessments, for example, but also do we have the mental health screeners in place to identify students who are struggling with mental health? That's kind of to assess needs and to identify students who need supports, but also do we have the continuous improvement, quality improvement systems in place to monitor the implementation and to, check using data-driven processes that we're actually making a difference. Well-matched to students. It's not just about saying we have Tier 1 strategies and we have Tier 2 strategies and we have Tier 3 strategies, but are the strategies really meeting the specific needs of students? So it's important to match the right intervention to the right need. They have to be fluid. A student, one of my pet peeves is when people say, oh, that's a Tier 2 student or a Tier 3 student. There are no Tier 2 or Tier 3 or Tier 1 students for that matter. There are Tier 1, Tier 2, and Tier 3 strategies. A student, first of all students are Tier 1 students because they're all getting the classroom instruction. But a student who might need Tier 2 services today, tomorrow they might need a Tier 3 intervention. And then that might work for a while, and that might provide some support, and then they might need additional Tier 2 support, or they might not eventually live out the need for Tier 2 and Tier 3 services. So you really need to be fluid, and that means having a way to continuously monitor students' progress. Obviously, this is kind of goes without saying. We want to make sure that the strategies at all 3 tiers are based in evidence to make sure that we're implementing things that have been shown to be effective. They all have to be coordinated. The experience of the student, to kind of think about whole child experience, means that we all need to know what's happening with each one of our students. If a student is getting Tier 3 services through a mental health counselor, does the teacher know that? What does the teacher need to know in the classroom? How to support a student when the student comes back to his or her classroom? And lastly, culturally competent. We want to make sure that the services that we provide at all levels match the cultural beliefs and traditions of our students, are linguistically appropriate, and truly that they address the specific needs related to different cultural groups. And with that, I'll turn things over to Maria.
Great. Thank you so much, Shai. So we actually will have a poll come up on the bottom of your screen. So how common is a multi-tiered system of support in your state or jurisdiction? And you can let us know at the bottom. Thank you so much for everyone who's voting so far. We're really happy with all of the engagement and sharing all of the information that you've shared in the chat. There's a lot of great information. So we see a couple of folks that it is relatively common in their states, and some who are saying slightly common, somewhat common. So if you'd like to, we'd like to hear some more about this in our upcoming chats. And we'll give you another moment or so to vote and let us know how common is multi-tiered system of support in your state or jurisdiction.
Yeah, Maria, I think that what we're seeing here is pretty common, which is that the idea of multi-tiered system of support has been getting a lot of attention, and at the same time, many communities aren't really using the approach in a very full way. So not surprising to see that folks have some ideas here kind of across the board as to how common MTSS may be. So as we're thinking about using this kind of approach, that one of the advantages of MTSS is it really can tie together a range of interventions that we may be doing in isolation. It's very common as we're thinking about different state agencies working on related interventions. sometimes well coordinated, but often not so much. So let's think a bit about the kind of role of community and state partners as we're thinking about this MTSS approach. The MTSS approach really takes the kind of mapping that we may do in public health interventions and really takes it all the way down to the level of the individual child or adolescent. And as we're thinking about how this may work, for example, as we're thinking about the relationship, as we're funding programs in communities, for example, that may be cross-sector programs that may include schools and other community partners. And we think about how mental health supports are typically provided. If we look over on the right-hand side here, we can see that typically those kind of mental health supports within schools happen at this kind of universal level. Having strong social emotional learning, both those kind of standalone programs and the infusion, and then there's a little less that maybe around the kind of the tier 2 supports for students at risk, and really less available within the school or school district, those kind of higher tier supports for the individual students at the times that they need those. If we flip out and look instead on the other side about how supports may be provided, mental health supports may be provided in the community, we see that there may be less happening there around those universal services, specifically mental health services and supports. There may be a lot that's happening to promote universal social emotional learning in out of school time, as youth development professionals have been doing that work for a long time. But really, we often refer out to the kind of higher tier mental health supports in the community. That being able to do this kind of mapping and be able to see where the resources are and develop a strong system to make sure that young people get the resources they need when they need them can lead to very positive results. So we can think about how this kind of school-community partnership might work. There's a lot of work happening in various places around the country. Actually, Wallace Foundation has supported a project that really is looking at and strengthening the connections between out-of-school time social emotional learning and in-school social emotional learning. That, and we can see that happening in community coalitions often do that work of bridging domains. Some of your states probably have had over the years the Safe Schools, Healthy Students grants, and that those grants really did, as we're talking about the next idea, with public safety and school partnerships, we can think about the connections between education and mental health around social emotional learning and mental health, but we also want to think about things like juvenile justice, law enforcement can be involved. The more we can build this in a comprehensive way, then the more we can be able to get the right supports to the right young people at the right time. And that can include referring out to outside agencies for, say, mental health care services. That also can include co-locating, bringing mental health outside agency mental health services even into school buildings or into primary care settings so that it's easy for young people to get the supports they need in a way that won't be stigmatizing and in a way that won't raise other kind of logistical issues. And for example, there's a project, Reclaim West Virginia, that was looking at the opioid epidemic. And they did a whole mapping activity that involved mapping the supports with local education agencies, communities, families, in order to address all those kind of different risk factors. So we can see this is happening more and more in different places across the country. So let's find out a little bit more about who some of your key partners are in your state. Who's working together right now around social emotional learning and mental health in your state?
And again, this is a chat. You can either chat at the bottom of the screen, or you can raise your hands, or just unmute yourselves and share some information about your key partners. I see Mark and Janet are typing. Mark, would you like to share with us who are your key partners around social emotional learning and mental health?
Sure. Just unmuted myself here, and I'll stop typing then. We partner primarily with our Department of Education as our pure state agency taking lead on this, but then we're also supporting we have local public health partners who are then involved in at the local school district level and supporting that way as well. But we have mental health promotion staff members within the health department. Again, we're thinking there on a technical assistance and or some policy levels, but I think probably our best metaphor is we're the part of the fuel or part of the engine that supports our primary partner, our Department of Education.
Great. Thank you for sharing. And Janet, do you have any information that you'd like to share about your partners?
Yes. I'm with the Tennessee Department of Education, and we do have a Project Aware in Tennessee, which is Advancing Wellness and Resiliency in Education, and it's a SAMHSA grant. It's a 5-year grant, and we are working in 4 districts around our state for a rural expansion grant, and we are expanding statewide mental health supports all around the state. Our goal is to replicate many of the activities we're doing in these 4 districts statewide. So starting this month, I'm presenting statewide in 8 core regions of our state, comprehensive school mental health supports for schools. So districts come to that training, and we are working with them on what to look at in the MTSS model. How do we go about providing comprehensive school mental health supports in all 3 of those tiers? So we will be starting that training shortly, because when we here in Tennessee, when we did our assessment recently, our needs assessment with all of our school districts, school mental health and social emotional learning were the 2, that was right at the top. Everyone was interested in how to get more school mental health support. So we have lots going on in Tennessee in that regard.
Wonderful. Thank you so much for sharing, and it's great to hear the perspective of somebody from the Department of Education sharing what's happening in the state. And I'm happy to hear that so many folks are interested in working on social emotional learning and mental health in Tennessee.
And we also partner with lots of state agencies, and we just had our state management team for Project Aware. So we have the Department of Mental Health, we have Tennessee Suicide Prevention Network, the Department of Children's Services. All of these folks partner with us in this endeavor.
Wonderful. Absolutely wonderful. Does anyone else have anything to share about your key partners, or if you are a key partner in the state that you're representing? Please feel free to chat at the bottom, raise your hand, or just unmute yourself and say hello. Okay. Well, if there's no one else, you can definitely continue chatting in the chat pod. Oh, I see Kelly from Indiana is joining us. Kelly, would you like to share with us some more information? Oh, no sound. Okay. So I'll just wait for Kelly's response, and then I'll share it out with everyone since Kelly can't speak. They're trying to bring Handle with Care to Indiana, systematized Handle with Care. Great. Thank you so much for sharing with us. And I see Jane Herway from Louisiana is typing. Jane, would you like to share with us some more information about Louisiana?
Yeah, so I'm sorry guys, I was on another call for another project, and so I just tuned in. But yeah, somebody mentioned Handle with Care, and that is something that we here at the Office of Public Health are not sort of spearheading, but our partners at the Department of Children and Family Services are trying to start a Handle with Care pilot project in one of our more rural kind of parts of the state. So that's something that's more to come on that soon.
Great, and you might want to reach out to each other offline to see if there's any information that you can share across state boundaries. Great. Mark, I see that you're typing. Is there anything else that you'd like to share about Minnesota?
Just that I was saying goodbye. I need to leave for another meeting. Sorry.
Oh, thank you so much for joining us.
Okay, you're welcome. Thank you so much.
Great. All right. So we'll continue on. And like I said, if you have any other additional information or resources to share, you can continue sharing them in the chat. Thank you.
Great. Thanks again. And just one comment I wanted to make based on the prior conversation. Jim mentioned Reclaim West Virginia. One of the things, if you go to their website, one of the components that they've done really well is this statewide support of Handle with Care programs, bringing together law enforcement at the state level and the Department of Education to really help this happen at the community level. So for those of you who are thinking about Handle with Care, I recommend that you look at West Virginia. Next, what we wanted to do is again, provide a specific case study of how we are working here in Massachusetts to help school districts build this kind of MTSS model for SEL mental health, with an emphasis on making sure these models are data-driven, evidence-based, culturally responsive, and sustainable. And so we're doing that with a partnership with the Massachusetts Department of Elementary and Secondary Education. I guess, again, that's our state education agency. And it's funded through, they're obviously funding us here at EDC with our partner Transforming Education. But the funding is really coming from the School Climate grant that the U.S. Department of Education is providing. So Massachusetts received that grant and is using that to support this work. So our work is based on the Massachusetts Multi-Tier System of Support framework. Again, this is similar to those frameworks that other states are putting together around MTSS. I saw, again, New Hampshire, you put a link to yours. I know that Virginia has VTSS, the Virginia Tier System of Support. I know Indiana, I know we have someone from Indiana on the call. I've seen the work that you're doing. So states are moving into developing these statewide frameworks. So this is the one in Massachusetts. And as you can see, the way they're thinking about it, much like other states are thinking about it, is that MTSS applies to the academic domains, behavioral supports, or including PBIS models, and also social emotional and mental health supports. So our academy focuses specifically on social emotional and mental health supports. In fact, we're one of 6 academies that the state is funding. The other ones deal with other topics. There's a PBIS academy, there's a math academy, a literacy academy. And in essence, we are really tasked with helping schools develop these competencies, these drivers for effective MTSS implementation. So just very briefly in terms of how we go about our work, so we have a few key principles that are part of our approach. Number one is meeting schools and school districts where they are. We know that most of our schools, probably all of our schools, are already thinking about SEL. They're already trying to address mental health issues. This is, they see this on a daily basis. So really what we're doing is meeting them to help them build on what they're already working on. We also do this by building effective teams. So once a school district applies to participate in the academy, they have to send to us teams of between 7 and 10 people, which include a district representative, a school administrator type person, at least one classroom teacher, and at least one kind of mental health support person. And we work with them to become the change makers who are going to go back to their school to create the system that they need. And we do that through a delivery of engaging trainings, both in person and online. But we also provide customized support to every single team that participates. And through our customized support, besides the customized support that we provide, we also use that to identify what are some common themes and challenges that all schools are doing so that we can address them more systematically through our trainings. This is a 3-year process for each school team, each district team. When they come to us, they participate for 3 years, and we take in 25 school districts per cohort. So we actually have them staggered, so each year we add one more cohort. And within each year, we have a 3-day in-person institute for all the participants, and those are the images on the right, my happy colleagues. Each team also receives 40 hours of customized technical assistance or coaching to really take on what they've learned in the academy and really use it to develop an action plan that they work through the whole year. I should say the 3-day in-person institute is not back-to-back, which actually works really well. So we can actually give them homework and have them kind of bring new data, new information, or not new, but to bring their data or to bring resources from their schools so that they can really have a working training. And then we also support them through online events and through a web portal. Now, a really important piece of this academy is that we not only work with the local districts to build their systems, but we also provide direct technical assistance to the Massachusetts Department of Elementary and Secondary Education so that they are also moving along with their districts to be able to better support what the districts are doing. So they too have a 10-person team that represents the various divisions and offices within the Department of Education. They also participate in all of the in-person institutes, and then they also have an assigned technical assistance provider who's working with them to build the supports that they need to better support the districts. And that includes looking at what other partners they need to work with at the state level. So how do we engage the Department of Public Health? How do we engage the Department of Mental Health? How do we engage the Department of Children and Families to create a comprehensive statewide system that will support this work at the community level? So I mentioned this is a 3-year process, so this is kind of the 3-year plan. The first year is really focused on mobilizing and designing your MTSS model, and I'll go into more detail in a second. Year 2, well, at the end of the year 1, they have an action plan of specific new strategies that they will implement. And in some cases, it's not necessarily a new program or a new intervention. In some cases it is. In some cases it's just a different way of coordinating the services so that there's a more coordinated approach. Or it could simply be adding a mental health screener, a universal screener for all students. Year 2 is focused on implementation and continuous quality improvement. So what are you doing how are you implementing the whole system as a complete, comprehensive system, and is it working for you? And if not, what are the things you need to fix along the way? And then by year 3, where they already are implementing this model, the focus is really on scaling up to all schools or all grades and sustaining this model over time. To make this even more kind of concrete, I wanted to focus kind of a specific slice and focus on year 1 and talk a little bit about what does that actually entail. What are the schools actually doing? What are they working on? So that you can also see where your work might fit into that. Because obviously these are processes we encourage any school to take to develop this kind of model. So it begins with assessing needs, mapping resources, current resources, prioritizing, and ultimately developing an action plan. And let me go through each step one at a time. So in terms of assessing needs, we want to make sure that schools are asking the right questions even before they look at their data. Oftentimes what schools will do, and we all do this, our organizational level, is we'll jump into what data do we have, and then we try to make meaning of the data. And what we're proposing is somewhat different process, first ask the right questions. What is it that you need to know in order to address the needs of your students, and then go and see what are the sources of information where you can get that information, that data. So the kinds of questions that we're encouraging them to ask are, what are the specific SEL strengths and weaknesses that their students currently have? This is kind of at a universal level, and especially to inform Tier 1 interventions, but also for Tier 2 and Tier 3, what are some of the challenges, mental health challenges that their students face? How many students meet some diagnosis for depression or anxiety, or just elevated levels of stress, even if it's not necessarily a diagnosable mental health condition? What students are, what is it that they're actually facing? And then more importantly, kind of digging deeper into what are some of those stressors that are causing these mental health challenges. Is there prevalence of family trauma, for example? In some of the communities that some of the work that we've done in Appalachia, for example, the opioid, this is outside of the Massachusetts Academy, of course, we know that a lot of communities are impacted by the opioid crisis. And so we know that, if adults are struggling with addiction and overdose, that chances are their children in their home who are struggling with the trauma related to that. So understanding that. Or is it academic stress? Is there high high expectations, too high expectations in your community that are driving students to really become overwhelmed with stress related to academic success? And also, what are some of the negative behaviors? What are some of the consequences of these stressors? Is it substance misuse? Is it absenteeism? Is it violence? And by better understanding that, we can then kind of be more focused in our interventions. And then that's when we go to data sources and figure out where can we get this information. And I think this is where it's really important to have a collaborative effort, because the schools are not going to have all this information on their own. They really need to work with whether it's local partners or even at the state level to collect this data. And I give in the slide a few examples of some of the data sources, including hospitalization data, data from community partners, law enforcement. The example of Handle with Care that we talked about, really is, in essence, it begins with data, with kind of identifying students who have a need, and that really comes from the law enforcement as a partner. Second, mapping resources. So what is it that you currently have that you want to add on to? And we talked about that, where we meet schools where they're at. So having a resource mapping of what are all the different strategies you already have in place. And it is amazing when you get 10 people of any organization, including a school district, and ask them these questions, how they learn from each other, how their strategies or interventions or programs that they might not realize are in place until they talk to a colleague. But then also where I think partners in particular come to play is where your role is important as a partner, is thinking about whether the resources that are available for schools to meet the needs of the students once you figure out what are the gaps. Are there particular community agencies that provide mental health services, for example, that can come in? How do you expand the resources based on what partners can bring to the table? Next, prioritizing. So once you figure out, what are the students need, what are the issues facing our students, what do we have, what is it that we need, how do you then prioritize what are those elements you're going to add to your model? And this comes from one of the CASEL guides, some 3 specific considerations: engaging diverse stakeholders, and I think this, I interpret this as being not only culturally and ethnically diverse, but also professionally diverse. Do you have a multidisciplinary team of people who are helping you think about how to prioritize next steps? And also considering school, district, and local contextual factors. What is happening in the community that we need to keep in mind that is impacting the students, that we need to kind of anticipate and be ready for impacting our students. And then lastly, action planning. So all that at the end of the year, we really help them, or not even at the end of the year, but halfway through the year, by the time they're done with the institutes, we help them develop an action plan. And I truly believe that having specific, timeline leads and specific benchmarks on paper really helps move the process along. And so making sure that the action plans really speak to everyone, that everyone sees themselves in the action plan is important as well. So that's the process that we use to work with districts in Massachusetts. Again, we're constantly talking to them about partnering with other organizations. But one thing that we have noticed and that DESE, our funder, Department of Education, has really helped us with is understanding what is the role of the state agency as well in supporting this work. So I hope that that kind of summary of what we do, kind of the whole picture of what we do, is kind of helpful in thinking what elements of this process can be helpful in your state. And with that, I'm going to turn things back to Maria.
Great. Thank you so much to both of you, Shai and Jim. This has been a really interesting discussion, and I think we've offered a lot of food for thought for our participants and our audience members today of how to engage their departments of education and other partners within their states to promote social and emotional learning and mental health. And I know that that covers and touches upon a number of our topics that we cover in the Children's Safety Network and that you are all working on within your state context. So I will we'll open it up to questions. Does anyone have any questions for Shai or Jim or even for each other? I see a couple of conversations have been happening in the chat while we've been talking and during the presentations. So if you have any questions or would like any feedback, that would be wonderful. And Jenny has also shared with us a short evaluation. There's a link in the chat pod, and she's opening it up now for all of you. So we are constantly in a state of quality improvement at CSN. So if you could please provide us with some feedback about your experience today, that would be wonderful. So do you have any questions or anything else that you'd like to share with us today based on what you've heard from Shai and Jim and based on what you've seen from your colleagues in other states? Okay. If you'd like to continue chatting in the chat pod, I would be happy to share that those questions with you. So just a reminder, many of you have already received some of our emails about this, but we are launching Cohort 2 of the Child Safety Learning Collaborative, and we would be happy to have you on our Learning Collaborative. So these are open to MCH and IVP programs. We would love to have you, if you are a new state that is not currently participating in Cohort 1 of the CSLC, you can access the first link on our slide right here. And if you are a state that's already in our CSLC, you can please apply through the continuing application. And all applications are due by next Friday, February 28th. And you can please reach out to Jenny Stern-Carasone with any questions or if you need a short extension. So if you are interested in participating with us, if you have any questions, you can definitely send us some emails, and we'll be happy to chat with you about that. Jenny, I see that you're typing. Is there anything else that you'd like to add here? Yes, we do hope that many of you will join or continue into Cohort 2. Great. So again, if you could please fill out our evaluation, we would love to get some of your feedback. And our next State Technical Assistance webinar will be in April. So please keep an eye out for our announcements, and we'll be happy to see you again then. Thank you so much to everyone for joining us today and for engaging in a really rich discussion about social emotional learning and mental health. Thank you all.
Thank you.